We now have all of our speakers in conference. Please be aware that each of your lines is in a listen-only mode. I would now like to turn the conference over to Miriam Bell. Ms. Bell, you may begin.
Thanks, John. Good afternoon and good morning to viewers on the West Coast, Alaska, and Hawaii. Welcome to our webinar, Delivering from a Distance, Reaching People at Home with the National DPP Lifestyle Change Program. My name is Miriam Bell, and I'm the team lead for the National Diabetes Prevention Program of CDC, Division of Diabetes Translation. I will be your moderator today. Throughout the webinar, please feel free to submit questions via the chat box. We've already seen that several of you have checked in from all across the country, so welcome. We will do our best to respond to chat questions during the webinar and will follow up after the event as well. Presenters may also ask you to type answers in the chat box. You will see it at the upper right of your screen. Today's objectives are to identify at least one platform to use for distance learning delivery of the National DPP Lifestyle Change Program, explain how to safely and securely collect participant outcomes remotely, and describe 2 strategies for making distance learning sessions interactive. Since this public health emergency emerged, CDC has worked to support CDC-recognized organizations in adjusting their lifestyle change programs to continue to offer the program to enrolled participants. We learned early on that a chronic condition diagnosis was associated with a more complicated disease process than those with coronavirus disease 2019 or COVID-19. This serves to heighten the importance of prevention and highlights the role of interventions like the National DPP in supporting the health of our nation. We have had numerous office hours and individual calls with organizations on the topic of how to move forward in the face of this public health emergency. We recognize that some of you are transitioning your in-person programs to distance learning. Others are pausing your programs until such time as it is deemed appropriate to bring in-person groups back together. In either instance, the Diabetes Prevention Recognition Program, or DPRP, is supporting organizations by ensuring their recognition status is not lost due to these uncertain times. Additionally, many of our partners have stepped up to make resources and tools available for organizations. The Virginia Center for Diabetes Prevention and Education, or VCDPE, and the Diabetes Training and Technical Assistance Center of Emory University, or DTAC, have both made available distance learning specific resources to help you during this time of transition. 2 other organizations, the National Association of Chronic Disease Directors, NACDD, Prevention Health Foundation, Health and Lifestyle Training, or HALT, and Fruit Street, a CDC-recognized distance learning organization with full recognition, are offering distance learning and online platforms for free during this time. Additionally, our partners at the Centers for Medicare and Medicaid Services, or CMS, have implemented changes that allow for easier enrollment as a Medicare Diabetes Prevention Program, or MDPP, supplier during the public health emergency, including waiving the application fee, criminal background check, and site visit. We are all committed to ensuring that participants have unfettered access to the Lifestyle Change Program in spite of the situation we all find ourselves in. It is a pleasure to introduce our 2 presenters today. First, we will hear from Ann Wolf. Ann is the director of the Virginia Center for Diabetes Prevention and Education at the University of Virginia. VCDPE has been engaged in diabetes teleeducation for 12 years and has delivered the National DPP Lifestyle Change Program through distance learning for the past 3 years, achieving full recognition. As director, she serves not only as a master trainer for VCDPE's online and in-person lifestyle coach training, but also helps to provide technical assistance and training to all national DPPs with a particular focus on Virginia. Anne earned her Bachelor of Science in Nutritional Sciences from Cornell University and her Master's of Science from the Harvard School of Public Health. Anne has been involved in telehealth since 2008 when she worked with BMIQ, a secure platform that helps dietitians and medical practices optimize obesity care through the use of technology. She has been actively engaged within the Academy of Nutrition and Dietetics, including serving on the Telenutrition Evidence Analysis Library panel, speaking about telehealth at the Academy's Level 2 Adult Weight Management courses, and developing a 4-part online learning module on telehealth. She speaks regularly about telehealth and distance learning. Our second presenter will be Sarah Piper. Sarah earned her Bachelor of Arts in Human Development from Arizona State University and her Master's of Public Health from Emory University. Sarah is also a certified diabetes educator. Sarah serves as the Director of Training for the Diabetes Training and Technical Assistance Center, or DTAC, at Emory University. In this role, Sarah designs, delivers, and directs DTAC's in-person, virtual, and distance learning activities for the National Diabetes Prevention Program. Sarah administers an organizational master trainer program for DTAC with over 100 organizational trainers, providing guidance, oversight, and continuing education for their training delivery. In addition, Sarah serves as a lifestyle coach for Emory University Healthcare's delivery of the National DPP Lifestyle Change Program to employees. Prior to coming to Emory, Sarah has worked as a certified diabetes educator and health educator in a variety of settings, including a local Atlanta nonprofit, Grady Health System, and a rural Navajo reservation in New Mexico, to name a few. Sarah is a frequent speaker on topics such as type 2 diabetes prevention, health literacy, facilitation skills, patient empowerment, and behavior change. Like many national DPP suppliers, Emory has opted to move their in-person groups to distance learning modality due to COVID-19. Sarah has been delivering the Lifestyle Change Program via distance mode for 2 groups for the past 5 weeks. I now turn things over to Anne to begin her presentation on the practical considerations when setting up your national DPP for distance learning. Anne?
Thank you so much, Miriam, and I'm so happy to be with you all today, looking at the chat and seeing people from all over. It's wonderful, so thank you for attending. It has been over 8 weeks since COVID-19 social distancing regulations came into effect, and many of you have already begun to set up your programs for distance learning and have learned a great deal already. So let's think about this as a time to not only learn from Sarah and myself and become clearer on the issues, but also to share your experiences through a robust Q&A and chat. We're going to begin with a question for you. Start with our poll question. Poll question is, where are you in the spectrum of delivering the national DPP through distance learning? Thinking about it? In the planning stages? Just getting your feet wet? Doing it a while. You are a distance learning ace. All right. So I think you can see it right now that we have spectrum. So Sarah and I have created this webinar for you to give you the entire spectrum of information. Thank you. All right. So the distance learning delivery mode really encompasses 2 technologies. The first, telephone or conference calls with a group, and video teleconferencing, which is the use of a platform that allows group participants to see and hear each other. Some people can enter by phone alone when using this video teleconferencing. The key distinguisher around distance learning compared to online delivery is that distance learning is live and it's synchronous, meaning that the coach is facilitating the class at the same time that the participant is attending the class. The first thing that we need to do is to identify whether we're going to use teleconferencing or video teleconferencing for distance learning, and then next, identify which platform to use. In the next few slides, we'll be reviewing some of the considerations when selecting a platform. Let's start with teleconferencing. Teleconferencing is simply the use of the phone to hold a group class. Today, there's a great intersection between teleconferencing and video teleconferencing, since all non-free video teleconferencing platforms offer the option of calling in by phone. Still, there is great simplicity in having just a phone number to call to attend one's group meetings, not wasting that precious minutes of our class time while we're waiting for others' video and audio to connect. In fact, the DPP research trials follow-up group classes were all done by video teleconferencing. By teleconferencing. This option works best for participants with no or poor internet connectivity, such as in rural communities throughout the states, or for just using the phone simplifies the entire setup process because everybody knows how to use the phone. There are vendors such as Free Conference Call, YPay, or Vast Conference, and there are costs involved. If a free conference call service is used, then the participant uses their service or minutes, and so for some participants, they may be paying for those calls. In addition, teleconferencing services offer optional add-ons that can make it easier or free for participants, but will end up costing you some money. For instance, the toll-free option makes it free for the participants, but you will pay the fee. And I figured out for a group of 10 people, the cost is about $14 per class. And that's about the same cost as a month fee of video teleconferencing, which is a great segue into video teleconferencing. Okay, the second distance learning technology is video teleconferencing. For this, both video and audio are available so that you and the group can see and hear each other. This can work for anyone with good internet access. If they can stream a movie, they can participate in video teleconferencing. Do they need to be tech savvy? It's really not needed anymore. Before COVID-19, many people were hesitant about using video teleconferencing, but now with friends and family meeting regularly on Zoom and Google Hangouts and other platforms, many of those that were tech fearful have traversed the territory and are now becoming tech comfortable. There are many different platforms available as shown in this slide. While we will share some of the platform names as examples, please remember that you have to choose a platform that best meets the requirements of your organization, and that CDC does not endorse specific products or services. Next slide, please. Okay, so when deciding upon what video teleconferencing platform to use, ask yourself the following questions, and it will help you to narrow your options. What engagement features do you want for class delivery? How easy is it for the lifestyle coaches and the participants to use? How many host licenses do you need, and what are the costs? Am I being HIPAA compliant with my organization or payer's requirements? Let's talk about each one of these questions. What engagement features do you want for class delivery? I'd like you to think about this as must-have versus nice-to-have features. Must-have features, well, nearly all platforms contain all these must-haves, but you really do have to have that audio and that visual so you can see and hear each other, and you want that free phone option because there are going to be times when people are going to need to call in. You want to be able to see participants' names and who's speaking, and you want to have some ability to interact. So you want to be able to show slides or share applications such as videos so that you can interact with a group. Not as necessary, but really nice to have are things like the Whiteboard, where you can brainstorm with your group, or the ability for your participants to share their screen. Breakout rooms really help to bring people into a smaller environment for more intimate activities. There are polls and there are reactions. And Sarah will be sharing examples of how to use these options. Next slide, please. Okay. The second consideration is ease of use. Assume your participants don't know how to use technology. A platform that has an easy, quick link that joins them to the meeting is more ideal than a two-step process that uses a link up front but then asks participants to download the opener for every class. You can use either, but if the platform downloads the opener, educate and train your participants about this feature so that they don't think they are, quote unquote, downloading something unsafe to their computer. Yep, this has happened to me. Send your participants the link and the phone number prior to each class to ensure the dial information is easily available. When sending participants the link and the phone number, make sure that you only send one phone number rather than copying and pasting the site's standard email that lists 12 different phone numbers. That's just TMI, or just too much information, and it's overwhelming. Whatever platform you use, provide your participants with simple training materials about how to get into the system, when to arrive to class, that is ideally 15 minutes early for the first 3 weeks until those tech issues start to calm down, and even some distance learning etiquette tips will help. Lastly, you also want a platform that's easy for you to use. Ultimately, all platforms are similar. Make sure that you go onto the platform with colleagues and practice a couple of times before your class so that you can be relaxed and comfortable during class. Next slide, please. Video teleconferencing platforms license their software to you through host organizer licenses and are based on the class size and capacity needs. For instance, the company may offer their professional license for $12 per host per month for the capacity of 150 participants in each class, while their business license costs $16 per host per month for a larger class capacity of 250 participants. Given the small class size in our national DPP classes, we typically only need the lower cost plan. Word of caution though, free plans often limit meeting length to less than an hour and do not offer the telephone call option. So these are not typically good options for the distance learning delivery of a national DPP. The question often comes up to us is, how many host or organizer licenses do I need? If you are an organization that has only one coach, you only need one host license, even if that coach gives 50 classes a week. The issue is trickier for the large organizations like the Cooperative Extension and the Balm of Gilead that have many coaches facilitating multiple classes every week. And the number of host organizing licenses boils down to the number of concurrent classes your coaches offer. That is, how many classes are offered at the same time and day of the week. If there are 30 classes but only 2 concurrent classes, then buy only 2 host organizer licenses. The final consideration is HIPAA compliance. HIPAA regulations were instituted in order to protect people's private health information. It's the responsibility of organizations to comply with any federal, state, or local laws governing individual-level identifiable data, including HIPAA. Many state and federal policies were loosened in response to the COVID-19 public health emergency, allowing DPP providers to use non-HIPAA compliant platforms during this period. But who typically must comply with HIPAA standards outside of this time period? Well, it's around healthcare. So healthcare providers, hospitals, health clinics, pharmacies, and in addition to this, organizations that receive reimbursement for the national DPP from a private health plan, such as United or Aetna, as well as Medicare and Medicaid. The cost of the video teleconferencing platform may vary based on HIPAA compliance. For example, Zoom is $12 per host per month for their Pro version, which is not HIPAA compliant, but $200 per account per month for their HIPAA-compliant version, which comes with 10 hosts. GoToMeeting and WebEx, on the other hand, are HIPAA-compliant even at their lower-cost versions. Regardless of whether or not you need to use a HIPAA-compliant platform, all organizations should protect identifiable data such as participant records according to HIPAA. It's time for a question. Okay, so here it is. If you're already delivering the National DPP through distance learning, what has been the most exciting part? And if you haven't yet started offering it, what excites you the most about doing it? So far, we're seeing a lot of understanding that this delivery mode can provide greater access to my program. Absolutely. We're also seeing equally just connecting to your group during this period of social distancing. We're hearing a lot from people how it's so meaningful to them that they're actually attending class more during this time. Wonderful. Thank you all very much. While HIPAA regulations have been loosened, it has always been okay for patients to send emails and texts to their providers, even if it contains private health information. The Office for Civil Rights, part of the Health and Human Services that oversees HIPAA regulations, states the following, quote, HIPAA security rules do not apply to emails or texts from patients. A patient may send health information to you using email or texting that is not secure. The health information becomes protected by HIPAA rules once you receive it. Therefore, once you receive private health information from the patient by email or text, record it elsewhere, put it into a secure location, and delete the email or text. The Office for Civil Rights also requests that you inform patients that their personal email is not secure and offer them an alternative way to send information or fax or phone line. Next slide, please. So given that information, now you can understand how to collect your participants' outcomes when delivering in distance learning mode. For weight, they can either email or text you their self-reported weight or take a picture of their scale with their weight on it. They can also email and text you their weekly physical activity minutes. And attendance is obtained by seeing or hearing them at the meeting. I want to end by sharing some final pieces of advice. First, have a backup plan for technical difficulties. It can be as simple as informing participants that when they are experiencing technical difficulties, that they can attend class by phone. Set up for the future in mind. Because so many providers have set up telehealth relatively quickly during this public health emergency, this may have compromised the type of distance learning program you would have ultimately provided. For instance, we may not have adequately trained participants so that they are comfortable using video teleconferencing platforms. Our facilitation skills are pretty new, so how can we improve upon them? And we may be using a non-HIPAA compliant platform even though we are associated with a health system. Those of us in telehealth are hopeful that some of the stringent rules and regulations that have been prohibiting telehealth access and reimbursement will be reevaluated. But now that the initial push is over, this is a good time to develop the type of distance learning program you really want by developing those access material, training, and licensing a HIPAA-compliant platform if your organization requires it. Third tip is train, train, and retrain. Make sure that everybody, including the participants, knows their roles and responsibilities. Make it hard to fail through thorough training and practice. And last, just do it. In the end, we all need to just do it. You will become proficient simply by doing it over and over again. Please don't let the perfect be the enemy of the good. I will now turn things over to Sarah to share guidance on facilitating lifestyle change programs effectively using distance learning. Thank you so much.
Thank you, Anne, and what a nice note to end on. Don't let perfect be the enemy of good. So as we go forward today, we're going to focus now on how do we use our strong lifestyle coach facilitation skills in this new modality for many of us. So with that, let's begin. Next slide. So our lifestyle coach approach. The most important thing to remember in our shift from in-person delivery to distance learning is that our approach, our mission as lifestyle coaches is the same regardless of the delivery mode. Our approach, as you know, is to facilitate rather than teach, to resist the temptation to answer all of the questions, and to believe in participants' own expertise to identify solutions and strategies that will work for them. So our approach is to create a group environment where group members support and problem solve with one another in service of their lifestyle change goals. We have to believe that we can maintain these approaches regardless of our modality. We may have to plan differently, adjust, adapt, and get creative when needed, but it can be achieved. So changing our modality does not change our mission to engage participants in their own self-discovery, problem-solving, and peer support. So with that, as our foundation, we're going to discuss just some basics of our facilitation in the distance environment. So I think Anne laid the stage well the way she concluded by talking a little bit about the adjustments that we all have to make as coaches as well as our participants. So just to normalize that a minute, we should acknowledge the newness for us too. Trying something new like this is like trying on a new pair of shoes. We may know that it's time to get those new shoes or overtime, but they're not as comfortable as the old ones. So when you first wear them, it feels a little awkward. It may rub on one part of your foot and take a few days to stretch out. So such as is as lifestyle coaches when we're trying something new with our groups. As Anne said in regards to technology, we will all become more proficient or more comfortable by doing it over and over again. So let's now consider how we might help our participants make this adaptation as well. So when we talk about using technology in general or specific platform tools that we're going to explore in a moment, we need to remember that these, again, may be like new shoes for our participants. So knowing your group will help you, one, identify how accessible a platform we might be using will be for individuals or the group, and two, will help us kind of know going in about folks' comfort level and the ways they may need support to make this transition. So knowing these things will help drive kind of your approaches in your early sessions in the distance modality. So assuming that you feel many of your participants will adapt to tools and technology, we want to ease folks in, we want to normalize things when they go awry, and we shouldn't hesitate to shift gears if things are not working. What is most important is that our group is gathering and connecting, bells or whistles or not. So we're going to review on the screen just a few tips for facilitation in the distance modality. And we're going to take a few minutes and go through each of these and talk about how they align with our priorities as lifestyle coaches, as well as how, some things to anticipate. So we're going to go over how to establish group guidelines using icebreakers, facilitation skills, the use of the CDC curriculum handouts, and creativity to aid us in having successful sessions. So ground rules from a distance. So likely when you begin your in-person programs, you engage in the best practice of setting group ground rules. Whether you are starting a new group or transitioning mid-program to distance, your first distance session should include time to set your distance group guidelines, or at least revise the ones you've been operating under in person. As you can see from the example slide depicted on the screen, we want to consider having specific guidance around active participation, despite the fact we're not sitting around a table together. We want to reinforce to focus and be present when you're there, despite the temptations we all have behind a computer to perhaps multitask. And we want to encourage folks to do what they might not in person, which is to state their name when they speak, which will be especially important for those participants who may not be using their video but just on the phone. But beyond specific guidelines, just taking time again in your first distance session, in those early sessions, or however often you need to acknowledge the shift and help make it easier for all to engage. It's super important. So next in our list of tips is probably, a no-brainer for coaches. Many of you do icebreakers every week of your sessions throughout the year, and others of us rely on them more in the early phases of the program. But when we're talking about a distance session where we may be either unfamiliar as participants with this way of connecting with people, or we may be programmed from a work perspective to behave in a different, more reserved way, icebreakers can help with that. So for one, icebreakers help and become kind of an easy way for you to take attendance of who is there, especially, again, if you have some on the phone and some on video. Secondly, icebreakers allow for all the participants' voices to be heard early in the session, which again helps set the stage for their participation. 3, icebreakers, if they're fun and frivolous, can add levity to the beginning of the session, which always helps. And 4, it can lend itself to setting the tone for the session content in a simple way. So for example, one lifestyle coach opened her session on eating out with an icebreaker question to share their favorite type of restaurant to dine at, or in times of pandemic to get takeout from. So icebreakers, again, can set the tone for interaction. All right, so displaying the CDC curriculum handouts. So while you and your organization will have to consider how you will provide each participant with their own copy of the CDC curriculum handouts, it's helpful from a facilitation perspective to have the CDC curriculum handouts displayed in your distance learning platform. This makes for easy visual reference during your session. It helps keep the session conversation focused on the content at hand when you want it to be. So CDC curriculum handouts, there's a variety of ways you could display those. You could screen share, depending on your platform, directly from the CDC website or wherever you may have your CDC curriculum files stored. Or you can display the participant handouts as slides. So as you can see on the screen, both the Virginia Center for Diabetes Prevention and Education and DTAC have the CDC curriculum participant handouts in slides and available for your use if that's helpful to you. So a word of caution, the temptation when you have slides on the screen just like we have here today is that we slip into teacher, lecturer mode versus facilitator. So as a gentle reminder to us all, the slides are there for a visual reference to guide the group session, certainly not as an invitation for us to become professorial. So let's focus on our facilitation skills. So most of us likely give thought before our sessions to which techniques we might use in a particular session. Our facilitation strategies might be based on what the topic is, the group dynamic or stage of development, or our group size. When facilitating from a distance, especially these first few weeks, as we're wearing those new shoes again, it is a good idea to have a general game plan for what facilitation approaches you will use. Many coaches using distance modalities, and perhaps you're one of them, open up sessions with a round-robin question, or we call it a carousel question, to warm up the group topic. So an example might be, we're going to go around the virtual room, and when I call your name, I want you to share a simple way to add physical activity to a busy day at home. Miriam, will you get us started, as an example? One difference using this technique that you may have just noted in the distance modality is that you will likely need to call on participants specifically to move the carousel question around versus relying on your nonverbal cues as you might in person. Once your group is more comfortable with your distance sessions, you may find that throwing out an open-ended question is good enough to get the conversation going. An example of one such question that might be enough to stimulate group conversation is as follows. Group, I want you to think about what has been the hardest thing about being at home related to your lifestyle change goals. I'll give you a minute to think about it, and then you're invited to share your thoughts when you're ready. So again, depending on your group's stage of development, you may already know once you've transitioned to distance that it takes very little to stimulate the group to talk. For others of us, if we were earlier in our group's relationship building, we may have to work a little harder in those first sessions to build that comfort with open-ended questions as our starting point. So let's get some practice ourselves, or perhaps just show off your powerful questioning skills. We're going to ask you to use the chat box, which all of you are demonstrating great proficiency with, and to give us an example of a great question that you use with your participants to start conversations. So we're just looking for a couple of open-ended question examples. How was your week? What are you proud of? Thanks, Stephanie. What are you proud of this week? What's your favorite summer treat? How do you feel now, and how do you want to feel at the end of the day? Wow, they're going so fast. Wow, what is your biggest success this week? What's your favorite successful goal with this past week? Great. See, I knew it. Proficient. Tell me what's been your greatest success this past week. I love that assumption that they've had some success and getting them to focus on the bright side. Awesome. Look at this. What tips from today's conversation will you use this week? Great. Kind of putting in that charge to apply what we've discussed. Great. Super. So you get the idea. And, you know, depending, again, on where your group is in its development, they're going to be more or less ready in a distance format to just take those questions and run with them. So again, starting with something a little more structured, like a carousel or round robin to warm up the group may be a good place to start, but you'll trust your group and your own insights as a coach to know when you can kind of shift it around a bit. So other facilitation skills, such as the ping pong technique, where you throw the question to the group, which involves, again, redirecting one question to another, brainstorming, summarizing, and the like, are also equally effective in the distance format. So our next tip, as you can see, is to get creative. So I want you to consider what you currently do or what you did in the past in your in-person session to make the content more engaging. I know many coaches do things like bringing visual aids. They may play a game relevant to the session topic or have props to illustrate a point. So whatever you might have done in your in-person session to make the content more fun, visual, relevant, or easy to relate to, you can find a parallel way to do that in your distance session to accomplish the same thing. So an example from a recent distance session a coach facilitated, the session topic was food cues or triggers. And the coach reported that in her in-person session, she had found a really winning strategy for her where she would make some microwave popcorn and hide it in the room. And it would always, of course, be met with groans and comments about how just the smell makes me want to eat it even if I'm not hungry and such and such. And therefore, she had a wonderful segue into this topic about the things that cue us to eat besides just hunger. So this coach was grappling with what to do to something similar in her distance format, and it turned out in her platform she was able to change her background, and she changed it to the image of a donut shop. And lo and behold, as her participants started to log in, the groans began. First about how the donut shop was closed, but then it became, gosh, I don't even like donuts, but those look so appetizing it makes me want one. So her point was made. To help make that connection. So a creative way. She did not, however, torture folks by keeping that background up the whole time. So other examples of creative tips for distance sessions includes engaging in light physical activity together during the session, such as walking in place, using water bottles or soup cans to do some arm presses, showing a short video clip that aligns with the session content, or playing a quick lifestyle change program trivia game. DTAC has one for youth on Common Ground. These are all examples of making sessions fun and engaging. So let's turn our attention to some of those specific tools that were mentioned earlier and how they might help us facilitate and engage groups in our distance modality. So a few minutes ago, Anne mentioned the must-haves and the nice-haves features on your teleconference platform. And I'm going to walk through how you can use some of those features to keep your participants engaged and drive home important points. While the tools available to you will vary based on the platform and the version of the platform, some of the features we will discuss are available. So we're going to look at webcams, as you can see, whiteboards, chats, and polls. So with webcams, when possible, we want to encourage their use. It's ideal to use them because it allows the group members to see each other. As you've likely experienced in meetings and the like, having that image of someone, their face, helps to stimulate your in-person experience, or simulate, your in-person experience, helps increase engagement of the group, and helps you as the coach gauge participant reactions and needs. If webcams are not possible for your platform or for some or all of your participants, consider asking participants to provide a photo of themselves that you can display as a way to make their presence appear as more than just a name or a phone number. Of course, what's most important is that the participant is present in whatever form and that we are intentional about including them in the session conversation. So making that list of names we talked about as part of your Icebreaker process can help ensure those on the phone get included. I had an important learning over the last 6 weeks with one of my groups that's transitioned to distance that I'll share, and it reminded me to be sensitive and responsive to participants' realities. After sending an email encouraging my entire group to use their cameras, one participant shared with me privately that she did not feel comfortable on camera. She expressed a feeling of exposure, having her image so close up when she was talking, and having her home environment on display made her uncomfortable. So this was a really important lesson for me to remember that each participant's comfort and reality is not the same, and that my job is just to help them feel connected to the group in whatever way works for them. So I pass that lesson learned on to you. So another feature that some platforms offer is the ability to annotate, and along with that often comes a whiteboard, just like you might have in a room that you're facilitating. So combining that ability to write or draw on the screen can allow you to do a variety of things. You saw a few slides ago of some pictures of emojis that a coach had put up to ask participants to choose the emoji that best represented their food tracking experience that week. And she taught them how to circle on the screen as a fun way to kind of get a pulse of the group. A whiteboard, as much as you might in an in-person session, allows you to document ideas and challenges, to help the group prioritize the conversation, to identify common themes, and to capture strategies for specific lifestyle changes. So if you don't have this feature, you can still scribe group brainstorms as you should, so you can refer back to them, and perhaps you may have an ability to even provide a copy of those brainstorms to your participants if it's relevant or helpful to do so. So a couple more features. The chat box, which you all are very familiar with here, you could use this in your distance sessions. Some coaches may use it just as a way to vary up their techniques, where they might say, all right, quickly everybody type in the chat box your favorite summer fruit, just again to kind of warm up the group. So the only caveat or caution that I would offer, and I know Anne concurs, is we don't want to, the nature of these groups is such that we're interacting, and they're never so large that we couldn't hear everyone's voices. So a chat box should be used truly as just a varying up your routine technique, but not one that you lean on to navigate the entire hour-long session. Similarly, polls, as you've experienced here today, allow folks to engage fun. It's fun to see what everybody's responses are. So putting up kind of relatively non-threatening questions like you see here, like what's your biggest challenge with eating out, can be a fun way to, again, get a pulse of the group and see where people have commonalities, similarities, etc. But again, not one we'd rely on all the time, since this isn't a class or a webinar where they're asked to sit quietly on mute. So speaking of polls, let's do our quick final poll of the day to see what kinds of the features that may exist on some of the platforms you use, which ones might you be inclined to use with your participants, or you may already be using them. So chat box, polling, writing or drawing on the board or slide. None of the above. I would be unlikely to use these. So we're pretty, so far, evenly split. Looks like polling might be pulling ahead. Chat box is close behind. Those might be the two that folks are most familiar with or have most easy access to. My participants are getting really groovy with the writing on. Sometimes they'll do it in spite of me, so that's kind of a fun element that's emerged in the distance groups. All right. Well, let's just close out with just a couple of things. With the permission of your group participants and the capabilities of your platform, you can record your session, and I find that that could be helpful for two purposes. One, you could provide that recording to a participant who had to miss a session, and it could also be development for you. You could listen to that session for your own development as a coach to hear ways you might be getting in your own way, if you will. So the last little thing I want to mention before I hand it back to Miriam is just to remind us of the important, regardless of everything we've talked about supporting our participants during this challenging time. So the beauty of group sessions, as you know, the Lifestyle Change Program is how participants make the content of the curriculum relevant through sharing of their challenges and strategies. And now, more than ever, we would be remiss if we did not give participants opportunities to talk about how this current pandemic reality is affecting their process of change. So the bullets on the slide give examples of conversations coaches are starting with their National DPP participants to help them stay connected in their own journey of change, but acknowledge this challenging reality that we're all in. And staying connected, whether your program's on pause, whether your program's transitioned, or somewhere in that realm, staying connected is so important. At minimum, we want to reach out to our participants in formats that work for them and check in with their groups, follow up with those who may have missed or aren't attending, to check in with folks who may need extra support or referral. Some coaches have found encouraging support and accountability buddies can also be welcome and helpful during this time. The last way we can stay connected has been provided to us from the CDC Personal Success Tool, which if you have not seen it, you need to check it out. It is on the CDC's website under Tools and Resources. And it is a tool that allows you to send modules that are themed to the CDC curriculum that provide nudges, support, and reinforce the ideas that have been conveyed in the sessions. This tool is based on evidence of behavioral science and has been tested by real participants and coaches. So check that out as a way to, again, stay connected, but again, to reinforce and keep people's eyes on the prize of diabetes prevention. So I'm now going to turn it over to Miss Miriam.
Thanks, Sarah. And now, actually, I'm going to pitch it back to you in a couple seconds. But I would now like to invite Sarah and Ann to share information about the available resources that they have through their respective organizations to support this work. So as you guys are transitioning from in-person to distance learning delivery, these are two organizations that do have resources that you might find helpful. So Ann, let me pitch it to you, and also let's keep in mind that we only have about 10 minutes left. So okay. Ann, I'll let you go first.
Okay, thanks. So besides, offering those online and in-person lifestyle coach trainings, our center offers custom trainings, and we'll soon be offering an advanced training in distance learning with CEUs really to dive a little bit deeper and help people feel more comfortable. We also offer free resources around distance learning, including the recent addition of a Spanish version of the Prevent T2 slide deck for distance learning. And then coming in late summer, we will have an online self-paced CME training available through the University of Virginia's Telehealth Village. Sarah?
Thank you, Ms. Ann. DTAC, again, offers a variety of types of training and advanced training and motivational interviewing and health equity and the like. But I mostly want to call your attention to Common Ground, which is our online learning community that any coach anywhere, you don't have to have been affiliated or trained by DTAC, can access. And we have a lot of resources and tip sheets there around the COVID crisis and beyond, as well as a discussion board where you can continue this kind of dialogue you're having in the chat box with other coaches around the country. So I hope you'll check it out. Thanks, Miriam.
Great. Next slide. So, Kathleen, actually my slide presentation froze up. So I'm on the slide that says other resources. So thanks, Sarah and Ann. And as mentioned earlier, NACDD and Fruit Street are both offering free access to their virtual platforms as well. We posted their website for you to visit for more information. And in addition to VC, DPE, and DTAC, we'd also like to mention the other training entities with whom CDC has a memorandum of understanding to train lifestyle coaches and master trainers to deliver the National DPP Lifestyle Change Program. They all play a critical role to ensure that we have a competent, well-trained workforce to support participants as they embark on the journey of the Lifestyle Change Program. And lastly, I'd like to welcome you all to visit the National DPP Customer Service Center, which provides organizations easy access to information and resources about prediabetes and the National DPP. You can access training materials, toolkits, and videos, ask questions, and receive technical assistance related to all aspects of the program. And before my computer died, I saw that there were a lot of questions being generated in the chat box, and several related to organizations specific around data submission to the Diabetes Prevention Recognition Program, or DPRP. And definitely I encourage you all to, who have those type of data submission questions, to log on to the National DPP Customer Service Center and create an account. And that way, that will allow you to pose your question and receive technical assistance and get connected directly to the DPRP team. So now we have a few minutes. I think we have 8 minutes to work through some questions. So a few questions that I've jotted down that I will pitch to Ann and Sarah to kind of weigh in on. Let's see, for this first one. And again, there are a lot of questions in the chat. I've written down a few. Definitely not going to be able to get through them all. So we are going to be getting a transcript of this chat, and we'll be taking a look at that. And actually, the chat will probably inform future webinars that we will be offering, especially due to the amount of interest that we've had in this initial session. So the first question that I will go to is, for those that have done video conferencing DPP, how many people do you allow to sign up for a class? How many is too many? So Sarah or Ann, do you want to take a pitch at that?
Yeah, go ahead, Ann.
Oh, yeah. Okay. So I find personally, when my class size gets too big, then I have a larger, I lose more people. So I really do like to keep even the distance learning classes no more than 15, 16 people, because it takes a lot of attention to bring to these people and to keep them engaged. And so that I've heard of people doing 20, but I personally can't do that, and I'm pretty experienced. Sarah, what do you think?
I 100% agree. I have two groups right now. One is 7 and one is 14, and I'm find it really stressed with the 14 just because I feel like it's hard to, the conversation doesn't flow as quickly as it does in person. So, you know, if you can by design keep them a little smaller, I think the engagement will be easier. But if you're just switching over, then, you know, you work with what you got, but I would, yes, refrain from the large groups.
Yeah, and even Tim Klein writes in, 20 is a class, not a coaching experience. Yeah. Love that, Tim. Thank you.
Okay, great. Next question for you both is, can you use the combination of phone and video for classes? Maybe some of the elderly can't do the computer format. What do you guys think of that? Ann, do you want to take a chance of that first? Okay.
Absolutely. No, we absolutely do both. That's why you have to have a phone number, because there are going to be technical issues, or there's older people that can't get on, or there's something that always happens, so somebody always comes in by phone. The challenge is when you're doing phone and visual is that you're going to need to share what's on the slide, if you have a slide, or really make sure that if there's any visual, you need to verbally say what it is so that they can be a part of the group. So it is definitely a little bit more work and repetition, but it can work. Sarah?
Nope, agree, and that's my reality with my groups. I have some on the phone only, and so it's a discipline for me to make sure I have those names written down and recognize that phone number so that I can, you know, bring them into the conversation for sure. But yes, we don't want to exclude anyone based on their comfort or access.
Great, and actually I'm a perfect example right now because I'm having technical difficulties, but luckily I've dialed in on the phone, so I'm still able to participate in this conversation. So the next question is about recruitment. Before I got disconnected, I saw a lot of questions about recruitment. So do you guys have any suggestions on recruitment for future classes if an organization needs to use distance delivery? Sarah, you want to answer this one first?
You know, I mean, obviously your recruitment strategies vary based on the type of organization and who you're accessing. So I think you want to kind of modify your communication to explain what's going to be needed to participate and reassure people they don't have to be tech savvy or tech comfort to participate, and upsell a couple of things, the ability to connect with others that are going through similar challenges, and the benefit of prevention that we are now seeing illuminated when it comes to risk for COVID-19 is another thing to consider. Ann?
Yeah, no, I've done a lot of these where when we recruit, we do in person, but I also do webinar recruitment. So if you have a set audience, it makes it easier, such as an employer base. So you're sending not only, well, we can't do in-person recruitment right now, but you can do recruitment through webinars, and people will attend. And actually, the people that are more likely to attend by webinar are going to be those that are going to be using distance learning. So that's a good way. The challenge that I'm really hearing from you all is that when, you know, you're working in the community, and how do you reach them, that you're going to do, you know, sort of a webinar recruitment session. And we have to think about those old-fashioned ways of flyers, newspaper ads. That's all I could really think of. Yeah.
Great. Now here is just a general lifestyle coach, and I'm sure all the lifestyle coaches will chuckle when I read this one, but this came through. How do you get people who talk too much and monopolize the conversation to stop talking?
I'm going to hand this to Sarah first. Sarah?
Oh, thanks, Ann. Goodness sakes. Well, you know, I could make a joke about the mute feature, but I wouldn't recommend it, and it's not what we do. So, you know, we talked about the ground rules just like in person, and I think maybe even more so when you have your first session to talk about the realities of what it's like. You know, we've all, well, not all, but many people have had that experience of over-talking, interrupting on a conference call or the like. So to kind of acknowledge that that's going to happen and we're going to step on toes, but we want to have the same spirit that we have in person where everybody's voice gets heard. So setting that expectation, and then you may sometimes have to rely on some of those more structured techniques of facilitation where you're calling names and going in a circle kind of thing, or just revisiting at the beginning of session. Hey, I want to make sure everyone's voice, we're a big group and virtually it's a little harder for us to get everyone's heard. So just kind of reinforcing those values at the beginning of the session.
Yeah, and it's okay it's okay to reach out to them privately and say, hey, I've noticed that you're responding, and that's wonderful. We love having you in class, and it's great. There's some quieter people, as you may notice, and let's hold back a little bit. It's okay to take them aside on the phone privately, and just as you would in a situation in person, private.
That's great advice. Well, we are at the top of the hour. So thank you both to you, Sarah and Ann, for facilitating such an informative webinar. And thank you to all of the participants who are on the line. We hope that you found this information to be useful and beneficial and helpful. Again, this webinar will be posted to the National DPP Customer Service Center in the coming weeks. And again, everyone be safe, and we appreciate your attendance. Thank you.